right.
Okay. Okay. Good morning, everyone. It is March 23rd, and this is the Senate Health and Welfare Committee meeting. And this morning, we are looking at H 265, an act relating to the Office of Child, Youth, and Family Advocate, and then we'll be moving on to H 153, looking at home and community-based services. So we've got some good work in front of us, and we have some great witnesses. Welcome to both of you, Amy and Mark. Thanks for being here. So we'll get started. We have gone through H 265 and heard from a few folks. And Amy, thank you for being here. Why don't you introduce yourself for the record, and we listen to your testimony.
Good morning, thank you. For the record, my name is Amy Rose, and I am a policy associate with Voices for Vermont's Children. Thank you for the opportunity to testify today. Voices extends our gratitude for your work on the many bills that impact children, youth, and families in Vermont. We appreciate the questions that came up thus far in your review of H 265. One of the most critical questions that you have asked was, what problem does this bill intend to solve? In order to answer that question, it is important to provide some context. If Vermont intends to be accountable to our children, then we need to listen deeply and open ourselves to uncomfortable truths. We are all learning together, and critical thought and evaluation matter. We need to remember that removing Indigenous children from their families and tribes of origin was once federal government policy in the United States. Foster care was also used as a punishment for people who could not pay their debt, sometimes alternatively described as a way to rescue children from poverty. Even with our best intentions and dramatically reshaped mission, the legacy of oppression within our systems remain, both in perception and in practice. For example, we know that nationally, Black and Brown families are more likely to be reported to DCF for child maltreatment. Black and Brown children and youth enter care at higher rates than their white peers. In Vermont, children of color have more placement moves than their white peers. Research tells us that the number of moves a child makes is directly connected to poor outcomes, including prison. Kids in care are far more likely to have kids in care themselves. It is all of our responsibility to break this cycle. In order to fully support children and families, we need to examine our current outcomes, review our practices, and open ourselves up to see the things that we have been trained not to see. In doing this, our entire child protection system will be better off. Make no mistake, this is difficult work, and it is complex work. It will take a proactive and solutions-based approach to get us to where we need to be. If set up well, an Office of Child, Youth, and Family Advocate will define current inequities in our system, reduce harm, and provide the state with the data needed to create a system that is responsive, restorative, and trauma-informed. We are the only state in New England that does not have an independent oversight body for our child protection system. Vermont's Advocate will be a place where you can refer your constituents to. It will offer you data to inform your budget and policymaking process. And with access to records and people, it will begin to de-weaponize confidentiality. There are some important points to consider. It is critical that this office be independent, both in practice and in perception, as that is the only way it will ever be trusted. Voices appreciates the office being placed outside of AHS. DCF asks families to show their vulnerabilities with the promise that we will help them find a path to a better place. An advocate offers the same opportunity to DCF and the entire child protection system. An Office of Child, Youth, and Family Advocate will center the needs of children in DCF policy. It will instill trust in the system by providing more data and increasing transparency. It will provide the state with independent, impartial view to allow for meaningful reform. It will ensure resources and funding are being used to maximum effect, and it will decrease long-term costs to the system by helping to ensure that children receive the care they need when they need it. An Office of Child, Youth, and Family Advocate will not be a replacement for reporting child abuse and neglect to DCF. It will not represent children or families in court, and it will not have the authority to overrule DCF or the courts, or the advocate will not become an advocate for any political agenda. Our child protection system has immense power, and with that power comes great responsibility. The right to remove a child from their home needs to include a safeguard to ensure that the people surrounding that child are equipped to support healing. This office will receive calls, track complaints, offer responsive and random case reviews, and mitigate errors in practice in real time. We know that harm has occurred in Vermont's residential programs, schools, and institutions. We do not have a clear sense if patterns of harm are continuing. Vermont's advocate will bring barriers to good practice to light so that they can continue to be addressed in a timely manner. Our advocate will serve as a critical source of information to take an honest look at how our children are faring and offer ways in which we can improve. The greatest strength and vulnerability of our system is that we are a system made up of humans. Sometimes we expend extraordinary energy trying to make the best of what we have. As DCF's legal counsel pointed out, our family services staff are currently operating with a data system that predated the launch of the World Wide Web. While updates are planned, our state workers are literally holding things together with a blend of Excel spreadsheets and a DOS operating system. This has been normalized over the years, but no one talks about the time when this system crashed and the staff relied on paper trails and memory to piece together vital information about the kids that our state has taken responsibility for. In this scenario, we are asking the impossible of our state workers, our families, foster families, and of our youth. Not equipping our workers with the tools to serve children and youth well means that medication errors occur, inappropriate placements happen, and avoidable trauma takes place. Vermont's advocate will keep you updated about the most essential investments at any given time and share where we need to do better while retaining the independence to do so without the perception of being self-serving. Some of you know that an advocate is not a new concept in the State House. The bill from last biennium was not the first time a child advocate has been discussed. Senator Lyons heard extensive testimony about advocate offices in the Child Protection Oversight Committee, which included establishing an Office of Child Advocate and its recommendations. As the Child Protection Oversight Committee sunsets, the advocate can ensure that there's consistent oversight year-round. Your committee has received a strong bill to vet. House Human Services spent much time exploring where this office should land. They proposed an office that is independent from the hierarchy at AHS, which is essential. At the same time, remaining a government entity will give the advocate office more authority and a more straightforward path to accessing records. If there are additional questions about where this office should be housed, Voices recommends looking to the Women's Commission and the Human Rights Commission for additional testimony. Voices would like to offer a few brief comments based on the recommendations that were provided last week. Voices agrees that it will be helpful to provide guidance, direction, benchmarks, and timelines for this office. The advocate office should work in concert with other state offices to ensure that Vermont's out-of-state placed youth and children are being served in alignment with Vermont's values, expectations, and expertise. Voices understands the hesitancy in creating separate oversight commission and an advisory board. Creating a space where impacted people feel comfortable and safe speaking up is difficult, and this structure provides an opportunity for direct feedback from impacted people. However, we also know that this office will get a great deal of feedback from the community by design. The Root Social Justice Center would be an excellent guide in weighing the pros and cons of this proposal. The scope of this bill should remain broad in order to give the advocate office the authority to investigate patterns of safety concerns for youth and children involved with the child protection system. While the broad scope could easily overwhelm, the advocate will have the responsibility to prioritize their work. Working with Vermont's current technology constraints is difficult, but it should not be a barrier to the work ahead. DCF and other advocate offices will be a valuable resource in setting up access to information and ensuring that DCF's reporting burden is minimal. The timing couldn't be better. The advocate can be included in the design of the new data systems. We heard the General Counsel share in testimony the number of record requests that DCF receives. This office should have direct access to information, which will eliminate the need for record requests from the advocate. Access to information remains difficult. As an outside advocate, I submitted a record request for a report on February 16th of 2021. I received a confirmation the request was received the same day. 13 months later, the request is still outstanding. As a state, we have valuable point in time information to work from between the CHINS report, the UVM report, the Child Protection Oversight Committee report, and the Families First Plan. Voices was pleased to see some common threads between each of these documents. The advocate could be tasked with monitoring progress toward recommendations within these documents. In summary, at a time when the pendulum is swinging towards family preservation and the state is holding the responsibility to support family well-being, it is critical that there be an entity that is dedicated to monitoring and reporting the impacts of policy shifts on children, youth, and families in our state. This minimal investment will allow for systems oversight all year round. There's often a perceived tension between family preservation and child safety. The goal is to have both. Striking that balance is difficult and work with very high stakes. This work is important and it takes time to listen, understand, research, and choose the path that will reduce harm and increase stability. Lastly, it is also important to note that this office will unearth areas that need attention, but it will also confirm good practice when it is occurring and highlight strengths to spread statewide. Using safety science, the advocate can minimize the risk and stigma that often comes with making mistakes. When child protection staff feel confident and competent about their work and their efforts with families, they won't view the advocate negatively, but instead as a valuable tool for learning and growth in their practice. I would like to thank each of you personally for your commitment to getting this right and look forward to working with each of you to center children and youth in your decision-making. Voices would like to urge you to establish this well-researched office as soon as possible, as there is much work to be done. Again, thank you for your time, and I'm happy to take any questions that you might have now or in the future.
Amy, thank you very much. That was comprehensive and very informative. I'm looking at the list of reports that you've cited. I know we've seen the CHINS report, the UVM report. Are you referring to the foster child report? Which report are you referring to?
Yes, I'm referring to the one this summer that provided recommendations about why our rates of children entering custody are dramatically higher than the rest of the country.
Okay, and yeah, and then the other one, our little, the Families First Plan. Is that a separate report that you're talking about, or simply the Child Protection Oversight Committee?
So DCF had to submit their plan to the state for implementation of Families First, and they're now engaged in a process with the federal government to negotiate that plan, and had offered to ask for legislative input during that process. And so we believe that the Office of Child, Youth, and Family Advocate could be very helpful in implementing the plan that Vermont agrees to.
Okay, thank you. I do have an interest in bringing Amy Davenport in regarding the CHINS project that's going on. So we'll do that. Maybe we'll see the CHINS report at that point. Then I guess I have a couple questions. I think let's see if the committee has some questions, and then we'll move on to Mark Redmond after that. So Senator Terenzini, you had your hand up.
Yeah, thanks, Amy, for that testimony. It gave me a lot of clarity as to what we're trying to accomplish here. I guess it's a question maybe for my committee. Amy recommended that this office be set up outside of AHS. How is the bill currently written?
I believe it's silent on where it is right now. It's an office established. And Amy, you want to clarify what you have seen in the bill as it's come over from the House?
Yeah, the way it's currently structured is very similar to the Women's Commission or the Human Rights Commission. So it's its own entity. It's not attached to any specific state entity, but it is underneath, it is within state government. And so it doesn't have a reporting structure within the Agency of Human Services. It's kind of a floating space. And having spoken to many people across the country who have established these offices, the key points that they've brought up to us is it's really important to have it not be within the reporting structure of the Agency of Human Services, but it's also equally as important to ensure that it has access to information. And so in the testimony from the House, there was a lot of consideration about whether or not it should be placed in a nonprofit, if it should be in the Agency of Administration, and ultimately they landed with keeping it separate from the current government structure, but keeping it within government so that it could have direct access to the case files.
Thank you.
Okay. So Senator Hooker, then Senator Hurd.
Thank you. I'm curious to know, how many kids do we have in protective custody?
I don't want to give you the exact number. I can look back with DCF, but it's often around 1,200 kids at any given time.
Thanks.
Did you say 1,200?
1,200.
I think we have that data somewhere and we'll make sure we get it because it does fluctuate. And then every time we look at a different report, so you look at Chin's report, you get one set of data, and then you look at the foster kids, you get another set of data.
Amy, thanks for your testimony. I'm sensing this sort of tension between, we heard this from DCF too about their data system or lack thereof, and their sort of Band-Aid approach to keeping track of everything, and how that might be, how it's clearly a barrier to providing good service and oversight and care and protection. It's also a barrier to access to the information for a potential Office of Child Advocate, because there's not, when we heard from the New Hampshire Child Advocate, it's like they have access to the system, they can just log in and get the information, but we don't seem to have a system like that one could just log into. So I feel like I'm sort of caught in this sort of catch-22. We need a better data system and we need an Office of Child Advocate. Do you know where, I mean, this is clearly a question for DCF, but you know, what, where is it? Is there a request for the system happening? Is it in process? Do you know by any chance?
What I've heard is that the first module of the DCF data system is within this current state budget. There's a $2 million ask for that.
Right, they did talk about that. Yeah.
And some of that is connected to Families First, because we will no longer be able to draw down our federal match if we do not improve our data system. We're the only state left with this DOS system in the country. And so the beginning stage is going to happen, I believe, as soon as an RFP goes out. And the budget is approved. I do think there is a plan to do the remaining modules. I think that the state has, or DCF has commented in the past, that updating the entire data system at once would overwhelm their current staff, that they need to do it in sections, and that makes sense. I think it's perfect timing in some ways to have a child advocate, because they can work the advocate into the process of establishing a data system. That the advocate can talk about systems in other parts of the state that might allow for multi points of entry. They can learn from what other folks are doing. And in the meantime, you know, they'll still be able to access what we have, and they'll be able to receive calls from the community. And just in that process, I think they'll be able to offer a great deal of information to you as a legislature around how kids are doing. I think one of the frustrations is that without an adequate data system, it's really hard to know the outcomes of our kiddos who have experienced care. And if we talk about foster youth who have transitioned out of care, we hear stories all the time of kids being transitioned into being unhoused. We hear stories of incarceration. We hear stories of untimely death, but we aren't able to know the rate of those occurrences. And so it'll be really helpful to kind of bring in an advocate with this new access to information to help us guide our practice.
So that being said, do you recommend or suggest any changes in the language of the bill, particularly as it relates to the sort of timing of the new data system and how their role may be with the implementation of a new data system?
I think that the bill, as it's currently structured, focuses around the advocate's access to data, and that's incredibly important. It could be helpful to guide the advocate to be a participant in how the data system is structured. And at the same time, I would, just like your committee has expressed, the advocate is going to likely get flooded with calls from the community and responsibilities. So I would like to give whoever ends up in this role the opportunity to prioritize their work. And so if they feel, given the system as it is, that their time is best spent participating in supporting the construction of the data system, then I would trust that that's the right place for them to be. But if they want to just give some advice and spend more of their time on sort of the critical safety pieces around children, youth, and families, then I would trust that that's the right decision as well. I think that having the structure that you have of choosing the right advocate is really important. We need to make sure that it's somebody who has excellent communication skills, knowledge of systems, and is able to be strengths-based in their approach. But I don't think the bill needs specific language around the data system, but I do think it would be important for the legislature and the advocate to continue to monitor the progress and make sure that the changes that are proposed are happening in a timely manner and that constituents are involved in the thinking.
Thank you.
Yeah.
Senator Cummings, any questions at this point?
No, I'm just getting depressed. Because we've got two issues. We need to make sure we have an advocate, but that costs money. We don't, the advocate from New Hampshire said that information system is absolutely critical, and we don't have that information system. And until we have it, the advocate is going to have one hand tied behind his or her back. I'd also like to know what's the turnover rate amongst social workers, because that's another piece of continuity that, you know, you got a different social worker. I mean, I've had the pleasure with my big red Be Elect sign on my car to picking up a foster child at the Budget Motel in Barrie because she was now 18 and she was out and she was on her own and had no idea. She just graduated from high school.
Right.
And she was just alone.
So can I frame what you're saying as a question that I think is a really important question that we should be asking? So suppose we have a child advocate in place and we've already identified deficits. So we've identified the data deficit. We don't have the information needed within DCF to accomplish the work. And then we also know that, I mean, are we bringing in an office of child advocate, someone who is going to tell us what we might already know in some way? So are we going to hear we need a data system, we need more social workers, we need to change the transition time for people going out of foster care? Are we going to hear all the things that we already know? What is it that the advocate will do for us that maybe a consultant or hired with some scrutiny to our systems would tell us? How is this advocate different? And are there priorities that you would see important for an advocate to have in place? So I'm trying to sort this out because as I've heard a lot about the advocate, and I think I look at what New Hampshire has and it's absolutely awesome. But at the same time, Senator Hardy's pointed out what we heard yesterday about data lack, and Senator Cummings is looking at some of the gaps in the system. Is the advocate only going to point out the gaps in the system? So just a
question. Yes, thank you for asking it. I think there's two pieces to that. One is the piece around the budget and the data system. And I think I can reach back out to the advocate who spoke from New Hampshire, but I believe they were doing quite a bit of systems upgrade to their data system when she began, and she began as a one-person office. And was able to set up a structure that worked. And so I don't think that the data system as it currently stands would be a barrier to good work. I do see this as an investment. Obviously, there's a price tag attached to the office, and I don't have in front of me the entire child protection budget, but if I recall, it's upwards of $100 million. And so this very small investment to make sure that that big investment is being used effectively, I think is a wise move for the state. We do have some information about some things that we can do to improve. I think the difference from this office from a point in time report is that it has two functions. One is the systems overview, which is going to be fueled by information coming from the community. And I think that's a big difference than much of the information that we have today. And so, I've heard, just because we don't have an Office of Child Advocate, I've heard from many folks in nonprofits, foster families, kinship families, families who have been impacted by the system, and youth, about sort of what happened in their case. And this office is also going to be a place where people can go when they feel as though either policies aren't being followed or their voice has been silenced in their process. And the current process for that is for a family or a youth or a foster family to talk to their case manager first, their family support worker, then to go to their supervisor, and then to go to the district director. And while that chain of command, makes a lot of sense, it can be really challenging, particularly for a family whose case manager has so much power over their family, to feel comfortable speaking up. And so oftentimes they don't share information that could be really helpful. And the advocate often, is able to kind of hear things differently and also share things from a neutral lens. And so they're not the person who removed someone's child, but they're able to say, here's the process, here's why it's designed. And they can look on their own to see if things are happening as intended. And if they are, they can diffuse some of that anger. They can report back and say, this is what you can expect next. This is why this is set up this way, and really just be a trusted, separate person to help with that conversation. If they're not happening the way they should, and that happens for lots of different reasons, they can report back to the office. And oftentimes that's what happens, is the advocate will go right back to the office and say, here's a case that could use a little bit more attention. Here are some things that I know. And when offices are prioritizing their work, they often listen to the child advocate. And when they build that trust, they know that they're not going to call them unless there is a reason to. And so there's that piece of it. It's the sort of instilling trust by having somebody on the outside that can help out in the moment that is not present in any of the current reports. But also some of our reports are very recent. Some of them are aging, and the recommendations may shift over time based on new information, new practice, and new shifts in the demographics of the people that the Family Support Divisions supports. And so each and every year, an advocate offers a report with updated recommendations and really specific priorities for each given year. And so while some of the recommendations may not be new, I think some of them will be, and often you probably will be getting testimony from some staff members from Family Services in the upcoming week in written form. And some of what we hear is, the things that we know are really critical. The things that we don't know are even more critical. And it's impossible because of the really important protections of confidentiality for people who know how our system is functioning to share all of the details. And so this office will take away that layer of confidentiality. It'll be, a small group of people or one or two folks in the advocate office who are able to really dig in and understand what's happening and then present it sort of through an independent voice without all of the details that would identify people and give you, much more detailed and much more current information.
So one last question, I think, as you're talking about this, and I'm thinking that much of our interest is always focused on DCF, but there are other agencies involved. And so, so let's just imagine a transport question, the sheriff's department, and how involved can a child advocate office get in that whole area of caring for kids?
I appreciate that.
Among others.
And if I'm not answering the questions fully, please.
Yeah.
Yeah, I think, I know that your committee has brought up gaps in the continuum care, concerns about current and concerns about transportation, other pieces. And I think that the advocate, the way the bill is currently structured, the advocate will have the opportunity to respond to patterns of concern. And so if a child is being or if there's an allegation of abuse or neglect within an educational setting or within a residential program or within a family, there is already a process for following up with that. But if there's patterns of calls coming in and it doesn't feel as though the responses are adequate to resolve the patterns, then that could be a policy issue. That could be a practice issue in a specific district. It could be a whole bunch of things, and the advocate will have the opportunity to follow up and prioritize those pieces. So with a transportation example, if there's continuous reports coming in to the advocate office that there is a difficulty in reporting from transporting youth from a specific part of the state, then they can look into that and they can see, they can look at records, they can talk to family services staff, they can talk to the transportation providers, they can talk to nonprofits and really dig deeply and understand why, and then propose solutions. And the New Hampshire office has many examples of just like small in the moment solutions that they have proposed that have been implemented and have made life easier for all that are involved. And many of those don't end up in the report. They're just kind of in the moment problem solving pieces. But when legislation needs to change or when they're hitting roadblocks to making effective change, then that's when it would likely end up in a report and come to the attention of the legislature. And oftentimes, that's the importance of the ability to follow the threads and to interact with other agencies. And so that's, while DCF is not only responsible for child protection, right? It's also responsible for economic services and early childcare and many other things. We also know that the courts are an important component of the child protection system. We know that mental health system needs to be robust in order to support these kids and families. We know that multiple systems are impacted. But the goal of this legislation is to not create barriers to the advocate being able to figure out the whole picture. And so while they're focusing on children and youth who are in the child protection system, if the challenge is lead them into other systems, as long as they're connected to child protection, we think they should be able to continue to access people and information. And that can be complicated, but I think that, from all of your testimony this summer around Kern-Hatton, it's really clear that sometimes nobody has the authority to know more, and that can cause problems. And we want to make sure that this office always has the authority to follow information, knowing that they might not be able to tackle full system reform at any given moment, but they will be able to have the information they need to do the right thing in the moment, and then to give people information of what needs to be explored next.
Okay, thank you very much. This is very helpful. It's also directing some thinking on my part, probably others, about what might work. So thank you for that. Good committee, any other questions for Amy? Terrific.
Thank you so much for your time.
All right, if you're there you go. Oh, you're still there. You just switched places on the screen and we thought you disappeared. But if you're able to stick around a little bit, that would be helpful. I don't know whether the additional comments or questions, but it would be great if you could just say. So Mark Redmond is here. Thank you, Mark. And thank you for your work, by the way, at Spectrum Youth. We greatly appreciate it. Why don't you go ahead and introduce yourself for the record, and then we'll listen to your testimony.
Good morning. Thank you, Senator Lyons and members of the Health and Welfare Committee for having me. My name is Mark Redman. I'm the Executive Director of Spectrum Youth and Family Services. I have worked in the field of caring for youth in the foster care system, juvenile justice system, homeless youth, youth who are considered at risk of substance abuse disorder for 40 years. First in New York, then in Connecticut, and for the last 19 years at Spectrum as executive director. I actually testified on this bill last year in the House Human Services Committee. I think this is my third or fourth time testifying on this bill, going all the way back to 2008 or 2009, always on the House side. I think I've testified in this bill more than any other bill I've testified in my 19 years in Vermont, and that's because I believe it is very much needed. For one thing, there is a parallel office like this for individuals with disabilities. There is one for healthcare, and there is one for long-term care, but there is nothing for children and parents, and there should be. Even more importantly, when I worked in Connecticut, I worked for a nonprofit there for 4 years, and we took placements from the DCF system in Connecticut. And they had what they call the Office of the Child Advocate. And I saw firsthand just how effective that office was. It was an entity outside of DCF where parents and children and teenagers could go when they believed they weren't being treated fairly by DCF, or they believed that their rights were being violated. Without that, people have to go directly to DCF itself, and that does not work. Vermont DCF is primarily staffed, overwhelmingly staffed by people who are professional, who are dedicated, who are caring. They take their job seriously. That's the vast majority of workers. There are other workers who are okay, and there are other workers who are not okay, all right? That's just the reality. Given that, mistakes can be made. And when those mistakes are made, they can jeopardize the safety and lives of children and parents. And those mistakes can affect not only the individual parent or the individual child, but the entire family, and maybe even reverberate for generations. Workers at Spectrum, okay, I'm going to tell you something that's going to be very disturbing. Workers at Spectrum have told me there are instances they know of where a DCF worker suspects a parent of abusing or neglecting a child and will say to the parent, "You have 3 children. Well, if you give us one voluntarily, we'll just let you keep the other 2. But if you don't give the one voluntarily, we will come after all 3. I'm not saying this happens every time. I'm not even saying it happens frequently. But believe me, I have heard it from my workers. I'm pretty sure it's legally wrong. I know it's morally wrong, okay? Here's something else we hear. Young people turning 18 who were then discharged to homelessness. Senator Lyons, you were in the Senate in 2007. You helped us pass H449, which was exactly intended to prevent that from happening. Senator Racine was chair of your committee at that point, and we passed H449. I'm looking at a picture in my office I've had since 2007 of Governor Douglas signing that bill at Spectrum, because we helped to pass that, because it wasn't right that young people were hitting 18 and being discharged to homelessness. Again, I'm not saying that happens every time, but it does happen. In fact, I listened last year to testimony by the woman who's the child advocate in New Hampshire, and she talked about Vermont youth placed at the Sununu Center, because Woodside is closed, and they're turning 18, and they're calling Vermont DCF saying, "Hey, this child's turning 18 next month or next week. What's the plan? What's the plan?" That happens too, and that's not right. Nobody at Spectrum was surprised when we heard that from the person in New Hampshire. Here's another reason it's so important to pass this bill and create this office. It's not only about resolving individual grievances by parents and children. It's about recommending reforms which are very much needed in the DCF system in Vermont. I saw this happen in Connecticut. I saw how the Office of the Child Advocate made recommendations that actually made a difference in how that system functioned. I saw fewer children being placed in institutions and residences. I saw fewer children being placed outside of Connecticut. I saw more services put in place for families so they could keep children in those families. It wasn't strictly the Office of the Child Advocate that made the difference, but they were certainly major players in this. You may hear from officials at the Department of Children and for Children and Families that this office is an instrument of intimidation. It is not an instrument of intimidation. It is an instrument of accountability, and accountability is exactly what we need right now in our system. This office is not going to solve all the problems at DCF, okay? It's not going to solve the problem of data. It's not going to solve the problems of worker turnover. I heard all these things talked about her. It's not a panacea, but it is a major step in the right direction that I believe the Vermont legislature should pass. I truly hope that this is my last time testifying on the Office of the Child, Youth, and Family Advocate, and that this committee does what's right and gets this across the finish line, and it passes in the Senate and it becomes law. Thank you, and I'm happy to answer any questions you may have.
Mark, thank you so much. I know that you're speaking from a long history of experience, and that's very clear. It would be helpful if you have testimony in writing that we could put up on our webpage.
I will send that to Aaron. I'll send it to Aaron right after this.
Sounds perfect. Good. All right. Committee, questions for Mark Redmond on his experiences. So your work, you have Senator Cummings does.
No, I don't have questions.
Okay.
I just have something to say from my experience, but given my experience with the peer advocacy group and the reaction, I find myself hesitating to say it, and that's making me very uncomfortable. I've worked with abusive families. I've done the fighting. I know what happens. But I also know that it is not rare for one child out of 3 to be the target of abuse and the other two to be fine. And I just think before we're dumping on DCF, and sometimes it takes that bargaining. I also was a foster parent of a child that there was bargaining to get her out of her house. They'd been trying for 13 years, and when the mother said fine, they grabbed her and ran, and she ended up with us. But it's, I find myself hesitating to say anything in defense of DCF, which is just part of the system we're dealing with here.
Yeah, it's difficult.
It is.
And absolutely, because I think, Mark, as you said, many of the folks, or all the folks probably, are committed to helping their children, yeah, and families, there's no question. But when a human system has human errors in it, embedded in it. So, yeah, thank you, Senator Cummings. Any other questions or comments at this point? So Mark, the question that and I'll come back right to you, Amy, just a minute. But Mark, the question I asked Amy Rose earlier, that we know we do see some gaps in the system. We do see the problems in DCF. What is the value? What is the differential between having a child advocate in place as compared with having some consultant or organizational evaluation of DCF and others maybe transporting children. Is there value in having that global investigation as compared with or in addition to a child advocate?
So that's a good question. I mean, I think my experience in Connecticut was that when you had the Office of the Child Advocate, they had a lot of people, they have lived experience, people involved with it. And yeah, they, instead of giving you a laundry list, here's all the things broken with DCF, I found they were able to really help prioritize. They were able to say, yeah, there's all these difficulties, but these one or two things are the ones that we really need to focus on the most, so that legislators didn't get overwhelmed and feel like just throw their hands up, oh, the whole thing is broken. They really were helped to focus the issues. So that's why I think this office is important and how it can make a difference.
Okay, thank you. Amy, you wanted to comment?
Just in response to Senator Cummings' point, I think that is one of the things that to me is most critical about this office is that confidentiality goes both ways. And so when practice is appropriate, DCF is not able to defend themselves because they cannot share. So I think the ending of my testimony hopefully, talked about the point that that trust in our system is essential. And so having a place for people to refer back to confirm if practices are appropriate can be really helpful. It does feel like there's a palpable tension when people talk about the Department for Children and Families in our state. And I do believe that is part of why our turnover rate is so high for our social workers, and anything that we can do to kind of diffuse that tension and highlight when things are going well, and also to be really critical of ourselves and highlight when we can make adjustments from a safety science point of view, that we all make mistakes. We're all on a learning curve together, but we're making big decisions that have big impact. And so we can work together on those pieces. It feels really critical to me.
Thank you. Thanks for your comments. That was helpful. Any other questions or comments while we've got Mark and Amy here? Got some terrific historical information and a breadth of knowledge. So, Senator Hooker, Senator Terenzini.
No, I would just say that I think both Amy and Mark gave some incredible testimony this morning. They really helped me understand where we're at.
Yeah, good. Okay. So, we did hear from Mike Fisher, our healthcare advocate, and there was some thought about embedding a child care advocate in the legal aid environment. Have you thought about that as an option?
I have. I think that legal aid does incredible work. What I did hear from the department is that it's helpful for this office to not be adversarial in nature. And I know that one of legal aid's tools is to sue, right? And so we're not looking for another entity that would sue the state. We're looking for an entity that will join with DCF and shift practices and really help guide the work. One of the things that's been the most interesting in talking to advocates around the state, around the country, is that their trends and calls have been pretty consistent, and they've shifted over time. So oftentimes when an office is first established, the vast majority of the calls they get are from foster parents and sometimes families of origin. Over time, as the practices change and trust is instilled, those calls tend to decrease. And they start getting calls often from DCF workers directly at times, because oftentimes when you have kids who are in the CHINS process, or kids who might not be court involved, but are involved with the child protection system, there isn't a second set of eyes to really look at cases more deeply and confirm or ask questions. And so oftentimes it's a blend of folks who use the office over time and use it as a resource. And I think that speaks to the trust that's established and the ability to bring in different perspectives and have conversations about cases. And so I do think that having it within the state government will allow for that to happen. People are not going to necessarily call in if they think that there's going to be a lawsuit against them as a follow-up. And I also think that access to information is really critical. And one of the things that Mike Fisher testified to back in the House is that it was unclear if all of those pieces would be possible within the current structure that we have with nonprofits and Vermont state government. So it would take some work to figure out whether or not it was even an option to have the office in a nonprofit in Vermont. I do know that one other state has started a nonprofit and then moved through a long process back to a similar structure of, independence, but within state government. And I did ask, volunteer, foster parents, youth, families of origin, would you consider the structure independent? And they overwhelmingly said yes.
So I'd agree with Amy. I have a lot of respect for legal aid. They do a fantastic job, but I would rather see this office more along the lines of the Women's Commission, the Human Rights Commission. It's independent with direct access to the information system. It's connected to state government, but it is its own entity. It does not report to AHS or to DCF. I think this is what New Hampshire has, and I think they've got it right. I'm not sure what's in the House bill, but again, legal aid does a great job, but I would rather see it in a different way.
The House bill has it independent, just was that we had heard from the healthcare advocate, and then the suggestion was made, maybe legal aid is in place, but it doesn't sound like either of you would support that. That's helpful. Senator Cummings has a question.
No.
Comment.
I was just thinking, full disclosure, I work with Parents Anonymous, which has morphed into Prevent Child Abuse Vermont. But you do have a nonprofit out there, which right now is focusing on parent education and support. But there is a nonprofit out there that does work with both parents and children with the goal of preventing child abuse, and that may be an office.
It is a nonprofit that might be able to
house
this. Okay, so that's Prevent Child Abuse. You're talking about Amy Johnson.
Linda Johnson.
Linda Johnson.
And Doug Racine, the last time I saw him, was on their board.
Yes, he is. All right, Senator Hooker.
Yes, thanks. How would that group then access the records and?
Well, no, I think you're just looking for a place to house the office. That group should not have access to any records, just the advocate. Yeah, you've got to protect that,
Right.
the confidentiality of those records.
But having that advocate placed in that office wouldn't hinder the advocate's access to.
Not if it's an independent office.
Okay.
But under the umbrella, just like legal aid, and somebody has access to my healthcare records.
Right.
I don't think I want legal aid as an entity having access to my healthcare records.
Right, I think the confidentiality issue is huge.
It's huge.
And so, Amy, what I was hearing you say is that when a social worker from DCF goes to the advocate, then the information can be disclosed in a way that offers relief to the social worker and allows for the advocate to respond to the situation in a maybe a supportive, or it could be non-supportive, but at least to respond.
Yes, and Linda Johnson did testify in support of this bill in the past, and I imagine she would be willing to supply more testimony from Prevent Child Abuse Vermont if desired. I do think there might be some conflict of interest between the work that they're doing with families and the role as an advocate, but I would leave that to her to comment on if that was something you were exploring. I think any nonprofit, whether it be legal aid, Prevent Child Abuse Vermont, or anybody who's interested in this office will have the similar barriers to accessing files. And so from my perspective, it's not a criticism of Legal Aid at all. I think they're an amazing group. It's really about that barrier to access that I think would be present with any nonprofit that we explored.
I agree with Amy. I love prevent child abuse in mind. I have great respect for Linda, but same thing with Legal Aid. I don't think that's the way to go.
Okay, thank you. All right. Katie McClin is here with us. Does anyone want to ask questions of clarification of Katie about what is in the bill based on what testimony we just heard? Katie, are you there? She is. Good morning.
Yes.
Good morning. Nice to see everyone.
So you've heard some of the testimony and the questions that we've asked. Let me ask a general question about the bill because I'm not looking at it right now, but are there any priorities set? So priorities for how the office of advocate would be put in place. So what would they do first? What would they do second? Is that in the bill itself?
There is, in the sense that there are two responsibilities that the advocate's office would do during the first 6 months of its tenure, and then it would take on responsibility for the full list of duties. So those first two things that it has to do, first two duties are first, work in collaboration with relevant parties to strengthen the department's services for children, youths, and families. And second, analyze and monitor the development and implementation of federal, state, and local laws, regulations, and policies relating to child, youth, and family welfare, and recommend changes when appropriate. So those are the first two responsibilities. I don't know that that's so much a list of priorities as that's sort of what's feasible as the office is still getting on its feet prior to maybe a deputy being hired.
Okay, and so then after that work is done, then the work of connecting with individual complaints or individual social workers to help them looking for patterns. Is there any discussion of that within the bill itself, or is it more general?
There is language about patterns. Hold on, let me try to find that.
Okay. We probably will, what we'll do is we'll go through the bill again with you after we've heard our testimony and try to sort out our thinking about what's there. Any questions for Katie? Senator Terenzini.
Katie, I just skimmed the bill quickly, but what's the proposed cost of this if we implemented this?
Fiscal note.
That is a JFO question.
We'll bring Nolan into that question.
Well, I think it started at
120.
no,
And then it went up.
300.
Yeah.
It was two people, which was 300
300.
plus office space. But I think what we heard from New Hampshire is they morphed into 6 people. I mean, look at what you're asking. And was it $18 or $8 million budget in Massachusetts?
It's
18
huge.
employees and 8 million, but it was big.
Right.
Maine is very small and separate. But if you're gonna do it, you're gonna hear a lot from the public. You need to, if you're gonna do it, you need to fund it well. And that's my concern is
We don't want to have a mistake in that area.
you need to give it enough funding to do the job you want it to. You also need to make sure that DCF has the funding to do the job you want it to. And historically, children, frequently, if not usually poor children, have not been a priority in state funding. And so I feel some way I feel DCF is under attack and
Yeah,
for things that they aren't responsible for, because we haven't given them the
Right.
tools to do what they need to do. And now we're gonna put money into an office to tell them they're not doing.
that's where my questions about would a consultant help rather than having an office, so there's a lot here, there's a lot here, so. Okay, but Katie, we don't need, we'll get Nolan's,
Fiscal note.
fiscal note, I think we do have it, in our
Okay.
documents.
And I was just gonna
Remember,
direct you
put
just,
an estimate.
okay. I was just gonna direct you to section 7 of the bill. There is an appropriation in the bill. It's only for 6 months. It's 120,000. So that's not a full year because the bill is set up to have the office begin on January 1 instead of July 1.
Yeah, okay,
Two people for half.
all right. Other questions right now for Katie about the bill as it relates to the testimony that we just heard?
If I could just add, I just got an email from
Yeah.
Nolan and he's trying to join the meeting right now. He's in the waiting room, Erin.
Okay,
Where is Nate taking it?
yes. Good morning. Nolan, now he can hear us. Good morning. Senator Terenzini had a question for you, Nolan. Oh, he's
Nolan's muted.
Nolan, he's muted and he's having trouble.
Sorry, if you want to move on, I can get my question answered another time.
So let's see if he pops up. Does he know that he?
We'll see how Nolan handles frustration.
Yeah.
What's the question? I'm sorry, I missed it.
Fiscal note.
Fiscal note.
I was asking what the expense of this would be.
Awesome. I get that.
Saying you can't hear anything, but I don't know
He's,
why.
let him know that we'll come back to the question. We're gonna take a little break right now. Yeah. We'll come back to the question. Okay.
Okay.
Okay, thank you. Thank you, Amy. Thank you, Mark. I think and Katie we're gonna, oh, now he's here. Okay, we do have time. Oh, good morning, Nolan. Can you hear us?
He's muted.
No. Okay, let him know that we'll pick up another time and we'll come back to the bill. So we're gonna go offline and we'll take a break.